Good evening and welcome to the Washington Hospital's 12th Annual Think Pink Breast Health Awareness Event. I'm Laura Constantine, the clinical coordinator here at the Washington Hospital Women's Center.
And I'm Lucy Hernandez, Washington Hospital's Community Outreach Manager. We are thrilled to present to you on Facebook Live and YouTube. Think Pink is an opportunity to learn, celebrate, and remember.
We have a wonderful, informative program for you featuring experts on breast cancer, navigating health challenges during a pandemic, and the diagnostic advancements made here at the Washington Hospital Women's Center. And of course, there will be a fun cooking demonstration.
Our first presentation is by Dr. William Dugoni, who is a general surgeon and the director of Washington Hospital's Women's Center. Please welcome Dr. William Dugoni.
Good evening and welcome to our 12th annual Think Pink event. My name is Bill Dugoni. I'm the medical director of the Washington Women's Center. It's my pleasure to welcome you all to our first virtual conference for Think Pink. These are historical times calling for historical measures. Think Pink event is one of my favorite events of the year. I look forward to it every year, getting together with colleagues and patients of mine, both old and new, and revisiting. And it is my hope that we'll be all together again next year, doing this live and in person. One of my goals in this short introduction is to assure all of you that it is safe to access the Washington healthcare system, and in particular, the Women's Center. Your health is our utmost importance, and safety is our top priority. There is a lot of concerns, both locally and nationally, and that patients are not accessing the healthcare system for fear of COVID. That has led to delays in diagnosis, patients presenting with more advanced disease, and the problems that arise with that. We have placed several things in order to secure your safety. These include things as telemedicine, where you can visit your doctors by telephone or by video conferencing. We have a wide variety of educational support systems which are now virtual, including our virtual breast cancer support group. Patients who do access the center for mammograms, ultrasounds, and procedures will discover that once they come to the center, there are entry points where they will be screened. Everybody will have their temperatures taken. They will have a questionnaire done, and they will be issued hospital level masks. Once you make it to the center, you will see that there is social distancing in the center. There are several points for hand washing and sanitizing. You will see your healthcare providers wearing masks, and some wearing masks and shields for everybody's protection. We have strict protocols in place that are with cleaning and disinfecting the center and the equipment, all for your protection as well. So this is a very safe environment, so please don't delay care. We are a nationally accredited center of excellence. I'm very proud to say that we were the third center on the entire West Coast and the first in Northern California to achieve this national recognition as a center of excellence. What it means is we're part of a consortium of different environments. They are non-government based, they're nonprofit, but they are set up to ensure that centers are put together that provide the highest quality of care for the women in this country, and certainly in this area, the Tri-City area. We offer a multidisciplinary team approach to breast health. This includes close physician collaboration, primary care working with specialists such as surgeons, medical oncologists, radiation oncologists, radiologists, and pathologists, all to ensure the highest level of care. We have two very professional nurse navigators in this center that are basically the heartbeat of this whole program. To name all that they do would be impossible in this short introduction, but let me say that they are there for any needs or support that you may require in this system. We have high-risk screening, including genetic testing and genetic assessment to identify women at high risk, perhaps those who carry the genes that put them at high risk of breast cancer or other malignancies. We have multidisciplinary care conferences where twice a month a panel of experts get together. We evaluate all the newly diagnosed breast cancer patients, as well as those who are ongoing treatment, to ensure that they continue to receive the highest quality of care possible. We have a multitude of support systems and educational systems in place. A lot of them are virtual. This includes things like nutrition, diet, physical exercise, stress reduction, sleep, and things such as yoga and Tai Chi. We have lymphedema services for those who require it. Those, by the way, have also undergone the same strict protocols required such that it's safe to access the lymphedema clinic. We are reaccredited every 3 years. We undergo a very vigorous 2-day reaccreditation process. They evaluate several of our quality measures and metrics, and I don't mean to use or go through all of them tonight, but if you would like to have more information on that, feel free to contact me. But I just want to summarize it by saying of all the quality measures that are looked at, we exceed the national and state level on all those metrics. So as you can tell, I'm very proud of this center. I'm proud of everything that has been built here. We provide the highest quality of care. Those who access it know how well and how hard we work to make things very warm and endearing and safe to all those who are here. So again, I welcome you to this program. I know you'll have a very enjoyable evening. Laura's put together a very nice program with wonderful speakers and presentations. Please feel free to give us your feedback, both positive and negative, with regards to this presentation, this virtual conference. And we very much look forward to seeing you all again in person next year. Enjoy your evening and please stay safe.
Thank you, Dr. Dugoni, for the great information. Our community is very fortunate to have such a dedicated physician who cares so much on women's health. Our next presentation is Navigating Health Challenges During a Pandemic, presented by Dr. Nicolas Prionas, a UCSF radiation oncologist at the Washington Radiation Oncology Center. Without further ado, please welcome Dr. Nicolas Prionas.
Good evening. It's an absolute pleasure and an honor to be here with you tonight. I'm particularly proud to be a part of this fantastic event. Washington Hospital has a tremendous history with this event, and it's really a wonderful gift for the community and the Washington Hospital community. And I'm particularly proud to be able to carry on this tradition during these unprecedented times. I know it has become pretty cliche to talk about how unprecedented they are, but frankly, every day it seems to be becoming more and more true. We are living through a global pandemic. We're experiencing a long overdue civil rights reckoning. There's a climate change crisis leading to devastating fires and toxic air all around us. You know, navigating a cancer diagnosis is hard enough in normal times. This really is unprecedented on so many levels. Tonight, I hope that we can discuss and demystify a little bit about how to navigate a cancer diagnosis, how to navigate cancer treatment, and how to do it despite these unprecedented challenges. A cancer diagnosis is terrifying. It's terrifying for anyone. It's a terrifying moment in someone's life. It's this invisible foe that's come out of nowhere, strips us of control over our life, puts us through draining treatments. It makes us ponder our existence and question our future. Sounds a lot like what COVID is doing to us as well. COVID's another invisible foe that puts our future at risk and makes us worry, generates tremendous anxiety. I'm sure there are people in the audience who are listening who have survived a cancer diagnosis, others who have helped their loved ones or friends navigate and survive a cancer diagnosis, the treatments they went through. And you all have so much to teach us about how to navigate this unprecedented pandemic. Let's take a moment to just talk about what is COVID-19, and then we can talk more specifically about cancer care during this time. COVID-19 is the disease that is caused by the SARS-CoV-2 virus, a new virus that is spread now from person to person. And when someone is infected by it, a whole spectrum of severity of disease can be caused. Some people have few, if any, symptoms. And on the other extreme, some people have life-threatening symptoms. Most commonly, that's life-threatening respiratory problems, trouble breathing, resulting in being in the intensive care unit. And unfortunately, there has been tremendous loss of life from this virus. There's growing evidence that this virus has an impact on the small blood vessels. We're learning more and more every day. We've learned that This is a virus that's transmitted by respiratory droplets. In other words, when we talk or cough or laugh or sing, the respiratory droplets coming out of our mouth can go into the mouth or nose or eyes of another individual and cause the infection. Again, this is an invisible threat that's causing incredible anxiety and unfortunately leading to people avoiding taking care of their health care and specifically their cancer care. So let's jump to the point. Is it safe to get your cancer care? Absolutely yes. You might be confused because a few months ago, you may have been told to not come to the hospital. So what changed? Well, we needed to understand what was going on. We needed to understand what this disease is, what this virus is. We needed to understand how it's passed from person to person, what the symptoms look like, how people feel. We needed to know who actually was carrying the virus by developing a test to test for someone who has symptoms of runny nose or cough or trouble breathing. Was it the COVID-19 virus or was it something else? And because we didn't know how severe this could be, we needed to prepare in case there was a huge surge of people that became ill, needing high levels of care, rushing all at once to the hospital, with a worst case scenario of flooding the system and overflowing the resources we had. We needed to know how to allot resources by potentially delaying or postponing other people's care. And that we needed to know who could be delayed or postponed safely and how to do that. Because in no way were we ever going to sacrifice the quality of care or jeopardize the quality of care that we deliver here. For example, we, using evidence-based practices, figured out that we could take people who have breast cancer and before their surgery, some of these patients could go on to hormone treatment. And that could start the treatment process and allow a bridge to postpone their surgery until it was safer to be in the hospital, safer to come in for that surgery. We now understand much more than we did several months ago. And we've developed procedures and policies that are in place to protect you, to protect other patients who are here at Washington Hospital, and to protect all the staff that is here to help you and take care of you. So let's talk about what some of those procedures look like. You'll see if you come to the hospital now that upon arriving at any of our buildings, you'll go through a series of questions to check if you have any concerning symptoms. Because we want to make sure if anyone is concerning that we should send them to get a test and be evaluated before coming into a building and exposing anybody else. Temperature checks similarly, check to see if anybody's maybe expressing early symptoms. We are limiting the number of people who can come into buildings, and in doing so, allowing better physical distancing. You know, ideally we should be 6 feet apart from each other, maybe more, so that we are not at risk of spreading these respiratory droplets. You'll notice protective equipment on all of your practitioners, specifically masks, as I'm wearing now, face shields to protect the eyes and nose and face. And we've developed other procedures and protocols to make sure that even in the unfortunate event that someone does become infected, which of course we're trying to avoid, but in that case, we can make sure to continue delivering somebody's cancer care and make sure they get excellent quality cancer care despite that situation, while simultaneously making sure that everybody else, other patients and staff, are also safe. But there are things that you also can do to make sure that you're safe so that you can continue getting the cancer care that you need or any health care that you need. First and foremost, that's wearing a mask at all times in public, practicing physical distancing, so staying 6 feet away from others, not touching others, especially around the face or eyes, not touching your own face or eyes, practicing really rigorous hand hygiene. I think we're all now singing some songs so that we remember to wash our hands for 20 seconds, soap and water, lathering up, cleaning and disinfecting surfaces that we frequently use at home, in our cars. But it also extends to things like getting your flu shot. And we're now entering flu season, so it's important to prioritize going and getting your flu shot to protect you potentially against the seasonal flu so that you don't end up with symptoms that may be confused with COVID, or worse, people who might be at risk of getting both infections. The flu shot will be particularly important this year. And the best thing you can do is staying on top of your care. That means asking the questions about what needs to be done, particularly if you're dealing with a cancer diagnosis. Let's dive into some of the common questions that are related to cancer care during this global pandemic. Many people ask us, should I be more worried about the virus because of my history of cancer or because I have an active cancer diagnosis? That is a completely normal thing to worry about and an expected question that we receive all the time. And in truth, people who are older and people who have a cancer diagnosis and are getting cancer treatment are more likely to have complications from COVID-19. Some cancer treatments can lower the immune system, weaken the immune system temporarily, and put a person at more risk for severe complications from COVID-19, for example, chemotherapies. So this all emphasizes those practices that we were just talking about to help prevent any exposure and to make sure that not just you, but others are safe. We also often hear about specific questions around cancer screening. Should I wait? Should I not go get my screening tests right now? With respect to breast cancer, mammograms are incredibly important to get every year to screen and try to catch a cancer very early. So if you can, it's a totally appropriate, and if you're due for your mammogram, it's a totally appropriate time to go in and get your mammogram. So I do not recommend hesitating or waiting. At the same time, if your mammogram is to be delayed by a month or two, it's not the end of the world. The whole point of the test is to catch something early, and the likelihood of it developing or spreading in just a month or two is very unlikely. As a matter of fact, we are currently rolling out increased mammograms and cancer screening with mammograms now offered on Saturdays. So please don't delay and prioritize screening so that we can try to catch things as early as possible. Another question that we often get is, should I delay diagnostic tests, the tests that are used to actually diagnose a cancer, and the treatments for cancer themselves? And the short answer is no, do not delay those things, but have a conversation with your doctor to figure out what is the right next step, what is the most appropriate test or treatment that you should start. Because in this time of this pandemic, that may have changed a little bit. To start, getting in touch with your doctor has revolutionized overnight. We are now using technologies like telehealth and telemedicine with video visits so that you can be in touch with your doctor from the comfort of your own home. The waiting room at your home is much better than the waiting rooms in the hospital. So I encourage you to reach out to your doctors, to be in touch and make sure you're on top of your cancer care. One important conversation will be, what is the right treatment to start? And as I previously mentioned, for example, in breast cancer, that might be starting pill medications like hormone medicines to bridge you till the time it's appropriate to have a surgery. It may be surgery now. It depends, and that's why it's important to have that conversation. In some cases, it's safe to wait to start treatment for some cancers. We don't expect you to know that. Just have the conversation. It's important to remember that if you are going through a cancer diagnosis, that cancer is more likely to be a risk to you than an infection that you don't have yet, or at all, or will never get. So, of course, we want to be careful, but you have to prioritize your care. As people say, necessity is the mother of invention. And by necessity, because of this pandemic, there have been a variety of innovations and inventions that are now being used in the clinic more readily. So that leads to the question, are there non-standard treatments that are being used during this COVID-19 pandemic, and are they safe? Indeed, there are. These are all evidence-based treatments that are safe and being proven to be useful and effective in people who are going through a cancer diagnosis. So for example, I can speak to radiation oncology. When we're looking to give radiation to the breast and lymph node areas to prevent a cancer from coming back, we traditionally offer about 5 weeks of daily radiation treatments. There are active studies and strong early evidence to suggest that maybe 3 weeks is equally safe, equally effective, maybe with less side effects. So you may find that a shorter course of radiation treatment may be offered to you. Not only is this still delivering excellent cancer care, but it's shortening the amount of time that you have to come to the hospital and be exposed to other people, other patients, staff, so that your risk from any infection is decreased. And again, I want to emphasize, these are all evidence-based decisions, but these innovations are being used more readily out of necessity because of this pandemic. Getting treatment, actually going through the treatments, is a unique experience no matter what. But now with this pandemic and with some of these restrictions, it's particularly unique. Admittedly, in an attempt to limit the number of people who are physically near each other, fewer guests are often allowed in the hospital, and that can make treatment challenging. Sitting for chemo with maybe only one guest, if any, can be daunting. But again, technology is here to help us through these challenging times, whether it's FaceTime or other video technologies, so that you can have your loved ones and friends virtually be present. There are ways to still be connected and have the support you need to get through these admittedly challenging treatments. And for those of us who are here to support somebody who has a cancer diagnosis or is going through that process, there are other creative ways to provide support when we can't physically be present. That may be outside of the hospital, that may be delivering care packages, food, support, whatever is the greatest need for that person. It's really a time to just reflect on what are the real needs of that individual as they're going through this terrifying time. So in conclusion, COVID-19 has had some silver linings, and it has taught us some really positive things. It's taught us that it is critical that we stay on top of our health, to prevent infections, but also that we stay on top of our health to deal with important and scary diagnoses like a cancer diagnosis. And it's reminded us how important it is to enjoy every day. We take care of ourselves. We go through these treatments so that we don't have to worry about this cancer coming back, so we can go on to live a high quality life, enjoying every day. So I ask that we all remind ourselves to take care of ourselves, to take care of others, to practice some of the things we talked about to prevent the spread of any infection, and show kind of a unified solidarity. This pandemic is an unprecedented trying time, but it has brought out the best in our field in medicine, and it's brought out the best in a lot of people. There have been new innovations. There's an undying passion to care for people and continue delivering high quality care. There are incredible people here to help make sure you get the care you need. Thank you so much for being a part of the Washington Hospital community. We look forward to being here if you need us.
Thank you, Dr. Prionas. Wow, what a wonderful message, and so detailed on how we address the pandemic to ensure the safety of our staff, but most importantly, our patients. Our next presenter is radiologist Dr. Sunil Upender. He will present on our new 3D tomosynthesis, our latest diagnostic advancement made here at the Washington Hospital Women's Center. Please welcome Dr. Sunil Upender.
Hi, my name is Sunil Upender. I'm a radiologist here at Washington Hospital. I'm excited to talk to everyone today about the latest innovation in breast cancer detection called tomosynthesis, or 3D mammography. And we've been fortunate enough to have this since early 2020, and it's been going extremely well. So just some common statistics that we know. Breast cancer is a very common disease. 1 in 8 women will develop this over their lifetime. And then every 2 minutes, a woman is diagnosed with breast cancer. And every 13 minutes, a woman will die from breast cancer. So we know the problem is real. And we also know that the survival rate is highly dependent on how quickly you can find the cancer and how small the lesion is and how localized it is, with a chance of near complete 98.8% survival in 5 years if you catch it early. So our main defense has been screening mammograms. And so usually you get 2 views of each breast. And on this image you could see on the right breast. This is taken from the side. And then this is also the right breast. It's a view taken from the top. And so that's kind of been our main weapon against breast cancer. We do an annual screening mammogram, take these 4 views. And studies have shown over the past 30 years of its implementation that there has been a reduction in mortality. Mainly looking at this side of the graph, that there's a 38% decrease in mortality. So it's been working, but there are limitations. And this is a diagram of a picture of a polar bear in a snowstorm, which is often how we feel when we're reading these mammograms, where we're trying to find these small cancers in the background of dense breast tissue. So there are limitations with 2D mammography. We know that we're missing 30% of cancers in our conventional mammograms, and that number is even higher, up to 50% in patients with dense breasts. Additionally, there's a 10% callback rate, which means that we look at images, there's something that we're concerned about, and then we'll have the patient come back. Obviously, that creates a lot of unnecessary anxiety. Now, here's an example of a very fatty breast, and here it's easy to see the small breast cancer in the center of the breast. But on this other patient with very dense breasts, you could see how you could easily not see this, a small lesion like this, and in fact, you may even have difficulty finding this larger breast cancer. So, what's the answer to this? They've been studying tomosynthesis for several years, and now studies have shown that it is efficacious, and that is what I'm here to talk to you about. The advantages of tomosynthesis, or 3D mammography, is that it helps in finding lesions and we're able to better characterize them and determine whether they're cancer or not. So there's an increased cancer detection rate. The false positive rate, which means if we have to bring a patient back, it reduces that anxiety. It helps us determine the exact localization of the lesion, and our positive predictive value is actually a real problem. It increases our confidence in that. So as far as the mammography system, it's similar to what patients should already be familiar with. It's the same type of unit. The technologist stands behind this unit, and the patient comes up to this unit. The breast is placed on this black plate, and there is this compression paddle. Again, unfortunately, you still need compression, just as before. Again, that's to optimize the image. We take 2 views, just like before, of each breast, and it takes about 4 seconds per view, so a little bit longer than the prior studies. And so basically, the X-ray machine moves in an arc over the breast, and that's the only difference, but the patient doesn't have to move or do anything differently, just the machine moves slightly differently. Basically, it's taking different angles of the breast. And then all of this data is compiled, and you're basically getting these slices through the breast, and then we're able to go through the breast as radiologists to evaluate different lesions. So here's an example of a tomosynthesis. So I'm scrolling up and down through the breast, so I can see every part of the breast, and lesions that may have been missed will be easier to identify. Here's an example. This is a 2D mammogram, and everything looks fairly normal, but then when you take one of those slices through the breast with 3D, you see the spiculated mass, which was a breast cancer. Similarly, here's a 2D mammogram. Everything looks very normal. There's dense breast tissue, but in this upper aspect, you see the spiculated cancer on 3D. Conversely, here's a 2D view that shows something that's suspicious looking down here. And so we would have the patient come back for that normally. But with this 3D image, we can slice through the breast and see that, in fact, there's nothing there. So the patient does not need to come back. But just bear in mind, we may still ask the patient to come back for additional views. And often when we do, we're even more concerned. So our positive predictive value is increased. The fortunate thing about this device, it does have a capability to do a biopsy on it. So if we do see a lesion, we're able to then go ahead and perform a biopsy on it. Numerous studies have shown that this is an efficacious study. It's almost becoming the standard of care now. And here is a large study looking at 500,000 women. And basically the results are very promising. It shows that the cancer detection rate has gone up by 41% with 3D imaging. So this study of 500,000 women showed that the cancer detection rate went up by 41% with tomosynthesis. And then also the recall rate went down by 15%. So we're bringing less patients back, decreasing anxiety. And then our positive predictive value for both the recalls and for biopsy, meaning if we're recommending you to come back or if we're recommending a biopsy, our confidence has gone up. Now, here are some examples from Washington Hospital that are from this year. And here is kind of a two-view view of the breast, kind of the old-fashioned way. You don't see anything concerning. But then when you do a tomosynthesis image through this breast, you'll see that there's a spiculated cancer in this upper breast. Might be hard to see, but we can, as we could scroll through it, we can find that exact spot. And then we can take additional views and see the spiculated cancer. This is a 55-year-old female. Again, just looks like a dense breast on these two traditional views. But when we do our 3D image, we can see that there will be a round mass right in this region. And then we did an ultrasound of that, and that does confirm a suspicious mass that was biopsied and proven to be malignancy. Finally, there's a 48-year-old female. This is a very busy mammogram, a lot of things going on. You could easily pass by the cancer, but when we do our tomo image, our 3D image, you can see this very spiculated mass, which was proven to be a malignancy. This just confirms that same area, this mass that was biopsied. So there are a few disadvantages with tomosynthesis. Since each picture does take a little bit longer than the old system, there is a greater chance of motion for each mammogram. But again, that's very minimal. It is slightly more costly than the old-fashioned 2D mammograms, but it's minimal. It's about $7 to $9, and as this becomes more standard of care, insurance companies should catch up, and this should be fully covered. The interpretation time from the radiologist is increased because there are a lot more images to look at, but again, that's time well spent, is how I feel. So it's not a disadvantage to the patient, it's an advantage that we have more time to look at everything in the breast. Radiation dose was a concern in the past because it required twice the amount of radiation, but now it does not, and so that's another reason why we waited till the technology caught up with safety, and so the radiation dose is comparable to what it was previously. So in summary, there's increasing scientific data showing that tomosynthesis is useful and efficacious. It helps determine different lesions, helps characterize them, and most importantly, increases finding cancers. And then also it decreases false positives, so we don't have to bring the patient back. And it is beneficial for all women types. Studies have shown that it's not just the dense breast patients, it's beneficial for all breast types. And it also helps the radiologist in finding the lesion and being confident whether the lesion is benign or cancerous. So I'm excited that we have it here, and thank you for your time.
Thank you, Dr. Upender, for the informative presentation. The Women's Center extended their screening hours during the month of October on Saturdays from 8 to noon in honor of Breast Health Awareness Month. Our last presentation this evening is a fun cooking demonstration on helping us build a healthy plate. Please welcome Washington Hospital's Director of Food and Nutrition Clinical Services, Kimberlee Alvari, and Catering Manager, Alfredo Macias.
Every year, Washington hosts a Think Pink event to raise awareness around breast cancer during the month of October. And that awareness also includes the power of pink when it comes to nutrition. It's better health through nutrition as it relates to cancer. So today what we have for you is a cooking demonstration that's going to focus on cancer-fighting foods. We have 2 recipes. We have a pasta vegetable dish, which comes with 3 protein options. And then we have a salad recipe that is arugula, some apple, Brussels sprouts, and then a lemon vinaigrette. So we're going to get started with the pasta recipe. And so, Alfredo, before we get started, can you just kind of share the ingredients that we have on the table here for that pasta dish?
Absolutely. We have a lot of fresh ingredients here. We have some shallots and garlic that we're going to start a dish with. We also have some nice colorful peppers. We've got some really nice cherry tomatoes. We have chicken breast, our skinless grilled chicken breast. We also have cannellini beans, some low sodium canned tomatoes, and we have some spinach and some whole wheat pasta.
I really love all those ingredients, Alfredo. They're all really plant-based, except for, of course, you know, I know that you have some seasonings you're going to add later. But those plant-based ingredients that we have in here are really providing phytochemicals. And really, when I think of phytochemicals, it's the chemical within the food that helps fight cancer by repairing cells before it forms, decreases inflammation so cancer doesn't have an environment to thrive in, also boosts the immune system. And if that isn't enough, it really helps with weight management. Those phytochemicals are full of all kinds of flavor, beautiful colors, different flavors and aroma as well. So what are you going to start with in the skillet for us?
Okay, so we're going to make sure our skillet's really hot, and since it is, we're going to start our dish. Now first, we're going to start with a little bit of olive oil, and we're going to saute our garlic and our shallots. Make sure we get all this aroma from it. It should be smelling really, really, really good. So we got this.
That looks like a couple of teaspoons of garlic and just a couple of teaspoons of the shallots.
Yeah, you know, you can, depends of how much you like, you can add more or less, but pretty much about a couple of teaspoons of each is good. So you saute this really nice, make sure that the flavor starts to come, you can smell the aromas, and you can see that it starts to get translucent. That's a perfect time. Now, once you add that, then we can add our peppers. We have all nice color peppers. Mix them all in really nice. Get them all together. Get all these flavors to marry together. And then we also
the colors that we're already seeing in there.
Isn't that beautiful?
It's really pretty. And then again, it's the phytochemicals that are giving the color to these vegetables that are in here that are, you know, the chemicals or the fighting chemicals that actually are in the diet that help prevent the cancer. The exception, though, would be those shallots and the garlic you have. They don't really have any color. They're white, but they do have allium, which is a phytochemical, what we would consider a cancer-fighting food as well.
Yeah. So we're going to add our cherry tomatoes and let everything cook for a couple of minutes.
How long do you think you simmer that? Do you simmer
probably
like
4 to 5 minutes.
4 to 5 minutes, so it doesn't really take very long.
No, not at all.
This whole dish should be done within about 30 minutes. It's just from start to finish, right?
Correct,
It takes about 30 minutes. A little bit of time to cut up and that kind of thing. Then it's just about getting it into the skillet and getting it cooked up. So
Yeah, absolutely.
what are the next items that
So
you're
the
going to
next
add?
step, we have a couple of protein options, as you mentioned earlier. We have a grilled skinless chicken breast, and we also have the low sodium cannellini beans. You can use cannellini beans to make it vegetarian, but in this recipe I'm going to use both. So I'm going to use a little bit of chicken and the beans as well. Yeah, you stir this nicely. Let the pen talk to you. It'll tell you when it's ready, when you flip, when you stir. So we add the beans.
So I know you're adding beans and chicken, and those are two of our protein options today in this dish. But if you wanted to leave the chicken out, you could leave the chicken out, and the flavor you think would be okay?
No, absolutely, absolutely. You still
vegan
get a
dish
lot
as
of flavor,
well,
yeah.
right?
You get a lot of flavor from the tomatoes, and as well as going to use some of this spice herbs here, so it's going to add a lot of flavor to it.
I see the beans that you put in there, and one of the things I often get as questions around beans is, are dried beans as nutritious as the canned bean? And in terms of the nutritional profile, the carbohydrates, complex carbohydrates, the vitamins and the fiber that are, and the minerals that are in the beans are the same nutritionally, whether they're dried or in the can. The only difference is when you have a bean, a dried bean that you soak, you can control the sodium content. So that's one way to kind of keep the sodium down in the dish that you're actually making. But gosh, the canned bean is super, super convenient, and you can cut the sodium by buying the low sodium, like I heard you mention.
Right.
The other thing, when you get them home, just drain them and rinse them out. You can reduce the sodium in those canned beans for about 40%. So you can make it convenient and still get that sodium content down as well.
That's right. Absolutely, yes.
And that fiber and vitamins that I talked about, those are all cancer fighting as well. Those phytochemicals, vitamins, minerals, they all do the same thing. Those tomatoes actually in there provide lycopene. That's a phytochemical that actually fights cancer as well. And as you cook those, the cells in the tomatoes will start to, those cell walls will start to break down and release that lycopene. So actually cooking tomatoes is a good idea.
Yeah, absolutely. So now you just let this simmer for a little while, and then once you let those flavors marinate all together, and then we're going to add some of the spinach. So we'll add the spinach to it.
So the
It
spinach
gets
is a
pretty
great
bulky.
source of beta carotene. That's something that you don't usually associate with those dark green leafy greens. You think of like butternut squash,
Some of
pumpkin.
our orange
The bright
vegetables,
oranges,
bright
so the
orange,
peppers
yeah.
that you have in there, the bright orange and red color types of vegetables. But those dark greens also have the beta carotene, which is an anti-cancer fighting nutrient. And you also find those in other dark greens like kale, collard greens
yeah.
as well,
Yeah,
both
yeah.
of those. Yeah.
Yeah, it's really nice. And then what we're going to add lastly, or to complete our dish pretty much, is our whole wheat pasta. I know you really like this whole wheat pasta. This is really good in here.
So that pasta, the whole wheat, you're right. That's one of my favorite types of pasta to use, the whole wheat, because it's recommended that of all the grains that you eat during the day, that half of them come from a whole grain. So this whole grain pasta is really a good addition to this skillet dish as well. It looks really good.
Yeah, so you just simmer this for a little bit longer, maybe 5 to 10 minutes, and it's pretty much done.
And I noticed that the pasta that you added in there was already cooked, so that you kind of have to cook it before.
Correct,
right?
yeah.
And then
Just
get
follow
it
the
in.
directions in the package, but pretty much it's usually about 8 to 10 minutes. And you get your pasta pre-cooked. You have it ready for when you make your skillet. You can actually cook it in advance. You don't have to wait till you make the skillet.
I think that helps too with getting dinners on the table a little bit faster if you have some of this stuff pre-prepped and ready to go.
Right, right.
So what are you going to add at the end here? What are you
So
going to
this
season
is pretty
it
much
with?
done. We're going to season now with a little bit of salt and pepper, a little bit of Parmesan cheese, and then we're just going to flavor a little bit with some fresh basil. And that's pretty much it. We're done.
And you can leave the salt and the pepper off if you want. I think there's such great flavors that are in this skillet dish that you can control that if that's something that you want to leave out, the salt or the pepper. As well as the Parmesan cheese. I know that's just added at the end, but especially if you want a vegan dish and you're just going to stick to the beans in here, you can leave the cheese out as well. But it does, just a little bit of that does add a lot of flavor.
Absolutely.
Do you
Why
have,
don't we
like-
taste it?
You want to put a little cheese on first?
Sure,
Or you
I
wanna go ahead and
actually
take a
want to
taste?
put some in the plate. Yes, absolutely. Here.
I gotta get a fork here.
Yeah, there's forks and knives on the end. So then we just get a little bit of basil, a little bit of Parmesan cheese.
Okay,
and
great.
here you go.
Got a fork for you too.
There you go.
Let's make a switch.
All right.
I'll take a quick bite. I got my mask on here, but I'll take a quick bite. Got to try this. It smells amazing. That's really, really good, Alfredo.
Oh, thank you.
I think when they say the most powerful medicine you'll ever have, you'll find it at the end of your fork, right?
Right.
Not in the bottom of a pill jar. So really good nutrition is really primary preventative care when it comes to your health and cancer, right?
This
This
very
is
good.
amazing. But I know we don't have time to make a whole nother recipe, but we really wanted to share some other cancer-fighting foods with people today and some recipes. And so I know you have a pre-made salad over here. We talked about it having the arugula, apple, and Brussels sprouts in it.
Right.
So you want to kind of just talk about the things you kind of put together and how that plate came together there, Alfredo?
Sure. So you can just buy the pre-clean arugula and just slice up the Brussels sprouts and the apples. I like to soak the apple once they're sliced like this up in orange juice just so they turn color and they keep a lot nicer. So you can have your salad there also, but if you can actually pack it up and eat it later if you going out to lunch or something. Here.
Yeah, so
this is what we got for it.
Packing it in a mason jar is what you're saying?
Yes, exactly.
Yeah.
So in order to get a bite of everything on your salad, you kind of have to make it in layers. So what you do is just put a little bit of each thing here, and then just, if we're building a lasagna or something like that, and just put a little bit of that, a little bit of parsley here, a couple of slices of apples.
And you could just kind of keep repeating those layers,
Correct.
right?
Yeah.
So you're adding a little bit of these roasted almonds?
Yes, the roasted almonds and a little bit of Parmesan pepper. Yeah, you can at this point you dress it up if you're gonna eat it sometime soon, or you can just leave the dressing on the side if you're gonna eat it the next day.
So you can make it the night before, throw it in the refrigerator, maybe have the dressing on the side, and then just put it together right before you're ready to eat it. Makes it really easy to work some extra vegetables into your diet.
Correct, yes.
And those Brussels sprouts have cancer-fighting properties of their own. They are cruciferous vegetables, and so they really are the powerhouses in terms of cancer prevention. So I like working those Brussels sprouts in there. You're not always a popular vegetable, but I think in this salad
really
you'll find that
tasty.
it really adds a nice flavor. And I think shaving them down kind of breaks kind of the
yeah, and actually, like you said, what we have with this dressing is a light lemon vinaigrette. It actually makes them taste really, really good.
That's really pretty. Part of enjoying food is enjoying what it looks like, right? Eating with your eyes.
Right,
so
yeah.
when you make food look nice like that, it makes it already look like you're going to enjoy it. Okay.
There you go. You make the last layer, and then you're good to go.
Perfect. And if you made a plate like that, you could either, well, it looks like you could eat this salad by itself. You could put it on the side of our pasta, but if you made a plate like that, you probably could use, a couple of our protein options, either mix in a little chicken.
Absolutely.
Or put the salmon on. So you could make this into an entree meal. So it could be a side or an entree.
Correct, yeah. If you want to have that as an entree, yeah, you can just easily just get the salad or the fish that we have over here. And we'll just throw that on top of our salad.
Got a whole different meal.
There we go.
Whole different meal. I love it. I love it.
And here's your salad.
Really beautiful.
Mason
Really beautiful.
jar.
You can see those colors and those phytochemicals and vitamin C and everything in here that's so healthy in the fiber. So what I'd like to do today, though, is I just wanted to wrap up on building a prescription for building a plate that is built to protect you, to be preventative in terms of cancer, to take you through any treatment if you're in, or for survivorship. What we do know is what you put on your plate is actually very prescriptive when a third of the cancers that people get are coming from a poor diet. I'd like to kind of wrap up this food demonstration just focusing on the prescription for the plate for fighting cancer and talking about how you put that together, because we know what goes on the plate is your best defense in preventative in terms of cancer or treatment or survivorship. And so if you go to myplate.gov, you can go on there and you can kind of get a visual roadmap of a healthy diet. And on there you'll see that half of the plate should be filled with vegetables and fruits. I think we've got you off to a great start today to get that plate filled up. We also took into account the quarter of the plate, which is the whole grains, which we put right into that skillet dish to make it easy for you. And then your lean protein, and that's going to be the skinless chicken that Alfredo talked about. Maybe it's beans or maybe fish, avoiding red meats or any cured or processed meats. Adding some dairy if you add to your meal, you're going to have some low-fat or non-fat dairy products to round out that plate, and that really is the best prescription that we can give you today as we wrap up this food demonstration in terms of fighting cancer. So thanks for cooking for me today, Alfredo.
Thank you. It's my pleasure.
Thank you, Kimberlee and Alfredo. That food looked amazing. And to all of our speakers this evening. And I want to thank Lucy Hernandez for all of her help and support putting on this event tonight. We want to especially thank all of you for attending and taking care of your health. Now, please enjoy photos from our photo contest. Hope you enjoyed those photos from our photo contest. Weren't they lovely? Winners will be notified shortly.
This concludes our program for this evening. Once again, thank you to all of our speakers for their expertise, and thank you, Laura, for your support as well. I really enjoy our teamwork. And thank you to our viewers for tuning in. The entire broadcast of this evening event will be available on our Facebook page.
Good night, all.